What am I up to again today? I'm a great fan of Dr. Beta Farrell, who's an aesthetic physician in California, and she did a post recently where she compared lower jawline and neck toxin treated on one side and untreated on the other. And I thought I would draw inspiration from her and do a full face comparison. You wonder why I'm single. What I'm going to do is I'm going to have treatment on this side of my face, and I'm going to leave this side completely untreated. We're all complex and we all have asymmetries or differences on our faces, and that's part of our unique attractiveness. And I'm different in that the brow on my right side is lower, my hairline is lower on my right side, and I did have work-related injury when I was a GP in the NHS in London, and I was assaulted, and I have some nerve damage in this quarter of my forehead, which really doesn't move. That's going to just mean that I won't treat above there. What I'm going to do is have some light treatment here on the forehead, a little bit here in the center, small amount on the crow's feet lines. I don't like to over-treat them because I'm 59 and I want to keep things natural. I will do a lip flip here on this side, and I'll have treatment in my mentalis muscle here on this side that's pulling my chin up over time. Also, I'm very strong in this muscle here, the DAO, depressor anguli oris, and it pulls down the corner of the mouth, and I'll have some treatment there. My platysma is really active. It's not the most attractive, it's just a good thing it's sweater weather. What I'm going to do is I'm going to have treatment along the platysmal bands on this side, and we call that turkey neck, and they're really just little gristly bands that form in that muscle over time. I'm going to have some treatment at the top of those areas. Sometimes we'll treat the whole way down, but sometimes just by working on the top fibers, we can knock out most of that activity. Hi, here's a quick update 24 hours after my half-face botulinum toxin treatment. It takes about 1 to 3 days to see the medicine working, and the peak effect is 2 weeks. But interestingly, even after 24 hours, I have some subtle differences between the treated side and the untreated side. This was on my treated side. Not a lot of difference yet on the forehead, but the crow's feet lines are definitely less on this side and a bit stronger on that side. I had a lip flip and I've got a couple of tiny needle marks on this side. It's subtle, but there's a beginning of more turnout or more show of pink lip on this side. What's interesting is I'm definitely saggier on this side, and the jawline on this treated side is better. If you watch this now, really interesting. My DAO, depressor anguli oris, is really pulling down on this side. And look at that platysma, really active, untreated, pulling stronger on this side. And then the treated side, much better, neater jawline, it's tucked in a bit more. And then compared to that side, really interesting. You can see how strongly I pull down on this side, and already on this side, that pull down is lessened and everything has lifted up a little bit. Not much difference yet on mentalis. That's a strong muscle for me, and that will develop and kick in over a couple of more days. But the biggest difference for me is that DAO, and the fact that the jawline and neck better on this side compared to that side. What I'll do in 2 weeks' time is I will treat this side so that everything balances out, but I'm happy to be a human experiment over the next few weeks and really see the differences as they develop, and I'll keep you updated. Take care, bye. I'll come back in 2 weeks and show you the difference. Take care, bye.